Good evening, good evening, good evening. I am Dr. Kimberly Smith. One correction, I am an internal medicine physician. Big difference, Dr. Betty, big difference. But thank you so much for having me this evening. We are going to be talking about metabolic syndrome, how it occurs, how you can reverse it. Hopefully all of you can hear me perfectly fine. I'm just gonna go on ahead and get started. Pretty much metabolic syndrome is just a combination. I'm sorry, I didn't even, you know what I hate? I hate when I notice misspelled words after I've started the presentation. It just irks me to the nth degree, but sorry about that. What is metabolic syndrome? It's a combination of different medical issues that when they are all occurring at the same time, significantly increases the risk of cardiovascular events. Cardiovascular events would include things such as heart attacks and strokes. They're actually the very things that lead to heart failure, kidney failure. So one of those medical issues is going to be diabetes. And with diabetes, I'm sure y'all have heard the criteria before, but just to go over it, people who have diabetes, they're going to have an A1C that's greater than 6.4. The A1C is an average of what the blood sugar has been over a 3-month period of time. You can also diagnose diabetes by just having a fasting blood sugar that is greater than 125. So either one of those. Pre-diabetes is also something that could be going on with you that could, when combined with other things, give you a metabolic syndrome picture. Pre-diabetes is having an A1C that is greater than 5.6. And actually what I should have put was an A1C between 5.7 to 6.4. And fasting blood sugar is going to be greater than 100. So whether it's diabetes or pre-diabetes, both of those, if combined with some other medical issues that we're about to talk about, they can all lead to metabolic syndrome. What causes diabetes? Sedentary lifestyle. Some of it is genetics. Some medications actually can cause diabetes as well. Most recently, I've been seeing a lot of cancer patients who a lot of the cancer treatments are making their blood sugars very, very high. So unfortunately, we see this a lot in medicine. You take a medicine for one thing and it helps with that one thing, but it also can potentially cause an issue somewhere else. But there are a lot of other medications as well, like certain blood pressure medicines that can also make your blood sugar go up. Certain cholesterol medicines can do the same thing. Hypertension. Hypertension is the next medical issue that when combined with others can lead to metabolic syndrome. Normal blood pressure should be less than 120/80. Elevated blood pressure. If your top number or the systolic blood pressure is between 120 and 129, or your bottom number, and your bottom number is less than 80, that's considered elevated blood pressure. Hypertension, we have stage 1 and stage 2. So stage 1 hypertension, your blood pressure, your blood pressure is going to be between 130 and 139, top number systolic blood pressure, or your bottom number is going to be between 80 and 89. I say or because if you have a top number that's 135 and the bottom number is 70, that's still stage 1. If you have a top number that's less than 120 and the bottom is 85, that's still going to be considered stage 1. So it's either or both of them. Stage 2 hypertension is a blood pressure of 140/90 or higher. And the same goes, top number is 150, bottom number is 80, that's still stage 2. So these are the different criteria that are met when it comes to hypertension. Now, what are the causes? Again, diet, sedentary lifestyle, genetics, a diet that's high in sodium. The daily recommendation of sodium for everyone should be less than 2,500 milligrams every day in a 24-hour period of time. So it is very good for each and every one of you to learn how to read labels. Pretty much anything that you can readily eat will have a label, and it will tell you how much sodium. Pay attention to the serving size. The best example of this is crackers or even potato chips. Most crackers, about 5 crackers, will give you about 250 to 300 milligrams of sodium. So if you're sitting there and you're eating a whole roll of the good old Ritz crackers, how many? About 20 crackers are probably in there. So if it's 5 crackers that'll give you 300 milligrams of sodium, if there are 20 crackers in there, you've had 4 servings. So you have to do 4 times 300. So that's 1,200. So pay attention to the serving size. What I tell patients is start counting your sodium at the beginning of the day. If you eat at fast food restaurants or chain restaurants, you can Google nutritional facts for and put the name of the restaurant in there. It will pull up the full menu. So if you go to McDonald's, it'll give you like a McGriddle or the Egg McMuffin, the drink. It'll give you the whole menu, and you can look at each menu item and see how much sodium is in each thing. But let me just give y'all a little bit of a little clue here. With fast food restaurants, McDonald's and Burger King for sure, their breakfast meals, when you get, let's say, the McGriddle, the hash brown, and a drink, those are nearly 2,500 milligrams right there. And of course, if you think of something like Popeyes, you already at that you're gonna far surpass it. When you think about plate lunches, you know, we go to the local cooks and get a nice plate lunch. Those plate lunches will pretty much start at a good 3,000 milligrams just to begin with. So be careful. High alcohol consumption also will increase your blood pressure. Lack of adequate sleep. A lot of people think that just because you're sleeping a few hours and you can function all day long, that's okay. But honestly, lack of adequate sleep, and I mean you need 7 to 9 hours, it increases or accelerates the aging process. So you want to be careful with that. People who have sleep apnea, you are at a very high risk for having hypertension, but not just regular hypertension, malignant hypertension, where the blood pressure can get to the 200s over 100s. And that's because everybody with sleep apnea that's not treated, whenever you're going to bed and you get into that good old REM deep sleep, your oxygen is dropping. And every time the oxygen drops, it is depriving all of your crucial organs of oxygen. And oxygen deprivation is what leads to organ damage. It's where heart attacks and strokes are gonna come from. So be careful with not using your CPAP or your BiPAP if you do have sleep apnea. And then there's good old stress. We do not give enough credit to stress. Remember, stress increases neurotransmitters in our bodies that are not meant to be at a peak for too long a period of time. So whenever you're stressing too much, those neurotransmitters are up there, and it, instead of it being protective, it becomes something that is pro-inflammatory, and it makes you more inflamed. It makes blood pressure worse, sugar worse, inflammation throughout the body that eventually can lead to heart failure and kidney failure. Next disorder that's up is low HDL. So HDL is the good cholesterol. Whenever you look at your cholesterol panel, you should see total cholesterol, good cholesterol, triglycerides, and bad cholesterol. The good cholesterol is very, very important because the higher it is, the better able it is to fight off the blockage that the bad cholesterol is trying to enhance. So whenever you have a low HDL or a low good cholesterol level, you are at a much higher risk of accelerated blockage. The HDL is what is helping to remove the cholesterol from your blood vessels. HDL in men should be greater than 39. In women, it should be greater than 49. So be sure to pay attention to your HDL levels. Causes of low HDL, diets that are high in sugar. It tastes great going in. It's not so great while it's inside though. Sugar will cause a displacement. It causes an increase in our triglyceride levels, which we're going to talk about in a minute. And in turn, it causes a significant decrease in our good cholesterol levels. Sedentary lifestyle. It's been proven that if you're exercising, if you're very active, that you can increase your HDL levels. So in turn, if you're not active, if you're more sedentary, you're sitting most of the time, not doing much when it comes to activities, that will make your good cholesterol go down. There are genetic disorders that can cause a lower HDL. Obesity and smoking are also causes of a low HDL. And high triglycerides are next up, another part of our cholesterol panel. The triglycerides have everything to do with sugar. Carbs, starches, and sweets will make the triglycerides go up. I pretty much tell my patients, anything that will make your sugar go up will make the triglycerides go up. So bread, rice, pasta, potatoes, junk food, if it tastes good, probably it's going to turn to sugar. So triglyceride levels should be less than 150 for it to be in the normal range. Anything that is above that, you put yourself in danger of being a part of that metabolic syndrome triad that we're going to talk about more. But causes of the high triglycerides, diet, like I said, high sugar diets, sedentary lifestyle, genetics, high alcohol consumption is another thing when it comes to triglycerides. Insulin resistance, which we'll also be talking about in more detail in a minute. Abdominal obesity is the last of the criteria. So abdominal obesity is not the same as just plain old obesity. Obesity we look at when we look at the BMI, the body mass index, which is what your weight should be based upon your height. So it's the American standard though. So a BMI that is 25 to 30 is considered overweight. A BMI that is greater than 30 is considered to be obese. Abdominal obesity though, because imagine, I know you've seen people who their frame is actually, it looks, somewhat on the normal, regular, or maybe even the thinner side. But then when they turn and give you that side profile, their belly is poking out to here. That abdominal obesity is the thing that puts you at a higher risk of having metabolic syndrome. So waist circumference for men should be less than 40 inches. For women, it should be less than 35 inches. And if it is greater than those numbers, then you're at risk of metabolic syndrome. So metabolic syndrome, you have increased risk of cardiovascular disease, fatty liver, kidney disease, polycystic ovarian syndrome, obstructive sleep apnea, even dementia and Alzheimer's. All of those things can happen as a result of you having metabolic syndrome. And metabolic syndrome, again, it's a combination of all of those different medical issues that I talked about before. When you put them together, you put yourself in the category of metabolic syndrome and put yourself at risk of all of these different medical issues that I mentioned here. And pretty much the problem is that it's directly related, the risk is directly related to increase in insulin resistance and inflammation in the body. Everything goes back to inflammation. So insulin resistance, we're talking about an increase in sugar in your blood, an increase in insulin in your blood, and all of this is caused by an increase of fatty tissue. So pretty much what happens is as you continue to gain weight, and especially have that or abdominal obesity going on, all of that fatty tissue, the adipose tissue, as it continues to accumulate more and more and more, it gets to a point where it actually cannot just fit in the belly, and it can't fit underneath the skin where it's supposed to fit. So guess where it goes? It starts going to our organs. So for those of you who are familiar with Akana, you know that we have the Flat Belly Lifestyle Program, and one of the things we talk about is a fatty liver. And when you think of that fatty liver, the best image I can give you is, think of a steak with the gristle all around it. That is what happens to our organs, the liver, our skeletal muscles. You start getting deposition of these fatty cells all around places where it's not supposed to be. And because those fatty cells are deposited in these places, when you eat, let's say you eat a donut. You eat a donut, your belly, the stomach juices are gonna break it down. You get the sugar that is released. So now you have a boatload of sugar in your bloodstream. In response to that, your pancreas is going to produce a boatload of insulin to take care of it. Now, under normal circumstances, what happens is on the left side at the bottom, you get the production of the insulin, you get the production of the sugar, goes into the bloodstream, and gets the insulin is going to bind to the receptors on the liver and on the skeletal muscles, and it's going to aid the sugar with transportation from the blood vessel into the organ. Whenever you're exercising and moving around, the energy that you use up is coming mainly from sugar. So sugar is a necessity. It is how we are able to get most of our energy. So the insulin that's produced, it's the transporter. It allows the insulin will bind to the organ. It'll bind to the liver, or it'll bind to your muscles, and it helps to transport the sugar from the blood vessel into that organ. So that's what's supposed to happen. Now, when we have insulin resistance, we have all that excessive amount of fatty tissue that's now deposited around the liver, around our muscles. And now what happens is, when that insulin tries to bind to the receptors on the liver and the muscles, well, now it's not able to bind properly. Pretty much those organs are resistant to the insulin binding properly. And so now the insulin can no longer be effective in moving the sugar from the blood vessel into the organ. So what happens now is, you have a whole lot of sugar in the blood vessel. You have a whole lot of insulin in the blood vessel. And when that insulin is up and up and up like that, it actually is a pro-inflammatory problem that's caused. It causes more inflammation to happen. And as long as that sugar is in your bloodstream in high amounts, it can also lead to the damage of your organs. I want you to think about sugar like termites. A little bit at a time, as long as they're in high amounts, a little bit at a time, they're chipping away at your organs, chipping away, chipping away, chipping away. And just like termites, you don't notice anything. I mean, if a little tiny bit is messed up, nothing. Just like the wood underneath our sheetrock, you don't notice a thing. But as the termites continue to eat through the wood, eventually you're going to know it, because now the structure, the foundation that's built holding up your walls, now it is no longer strong and able to sustain you. Same thing that happens with the organs. As long as that sugar is high, it keeps eating away at the organ until there's so much damage that has occurred. Now it's irreversible. And by the time you know it's happening, it's already in the irreversible stages that there's nothing you can do about it. That's why it's very important for you to see your physician at least once a year, because this is the type of thing that you don't know it's going on if you're not checking. I do still hear a lot of people say, oh, but I'm good. I feel fine. I don't need to see the doctor. If you don't see the doctor, you will not know ahead of time that your sugar has started going up or your blood pressure has started going up. Or when blood work is done, the blood work should be able to show you what your kidney function is and your liver function is. You want to catch these things early on so that you can do something about it. My motto is get it before it gets us. So you need to be proactive in knowing what is going on with your body so that you can take the proper steps to get rid of anything that could be a potential hazard to your organs in the long run. So insulin resistance is a huge factor here because the excess fatty tissue that we put on because we're eating too much, we're eating the things we should not be eating, it ends up causing an issue with the insulin binding to the receptor and allowing for the proper facilitation of glucose, sugar, from the bloodstream into the organs. So when we diagnose metabolic syndrome, we have 3 of the 5 criteria that must be met in order for us to truly say it's metabolic syndrome. We talked about the sugar, the good cholesterol, triglycerides, obesity, and hypertension. So 3 or more of these different disorders will give you the diagnosis of metabolic syndrome. So again, pay attention to your numbers, get a copy of your blood work so that you can know what's going on. And you don't need a doctor to tell you whether you have metabolic syndrome or not. You can decide to do this on your own so that you can be aware of what's going on with your body and you can take the steps that are needed to be better. So how can Akana do anything at all when it comes to metabolic syndrome? Well, remember, we're talking about something that is inflammatory. And everything about Akana is about reversing inflammation, right? And reversing disease. That is what's so amazing about this company. This is a company that has put together a string of products that we can pick and choose the different things that we want to incorporate into our lives on a daily basis that will help to reduce inflammation and start the reversal process of disease. So the first thing I want to talk about are the line of products that we have here. We have tinctures here in the bottle, we have the pain cream here, and we have gummies. And so first up, we look at the tinctures. For all the tinctures, these are the oils, the oil that goes beneath your tongue. We always start with 3 drops. 3 drops under the tongue, you let it sit there for a minute, and then you swallow. With the tincture, it typically will peak in your system in about an hour, and it'll last for about 4 hours before it starts to wear off. The gummies over here, the gummies on the other hand, first and foremost, our gummies are probably the most potent you're going to come across. Why? Because our gummies are infused with CBD. So every bite of gummy you take is going to be loaded and loaded with CBD. Because of that, you want to start with 1/4 of a gummy. My recommendation would be that you get your gummies and you cut them in 4 immediately so that you don't forget, because there are too many stories of, oh, I didn't realize, I forgot, or for our big, strong, healthy men, they feel like, I'm too big to take just 1/4 of anything. Or people who actually are what we call veteran users who feel like, okay, I'm way beyond 1/4. I need more than 1/4. Believe me, the gummy always wins. So do not take a chance. Better to start off with the low dose. You can always increase, but you can't take it back if you take too much. You just have to ride it out. But 1/4 of a gummy, when you take that 1/4, it will peak in your system in about 4 hours, and it will last for about 8 to 12 hours. So in the middle here, we have our Power Extreme Pain Cream, my favorite product. Why? Because I keep this with me everywhere I go. Pretty much everywhere you go, you will find somebody who has pain. And I know that I can just whip this out, put it on their area where they're hurting, and I know that they will have some pain relief before we leave. I actually had one of my cancer patients today, and for the past month or so, he's been complaining about neuropathy in his feet. So this was my first time getting to talk to him so I could see what was going on. He's been calling and complaining, and the oncologists have been giving him this and telling him to do that, and nothing has worked. He says every single day he has to be very careful getting out the bed because his feet hurt so much. And so we're talking about it today, and I told him, I said, did I get you to try my pain cream before? And no, because when he initially came to see me, he was stage 4 cancer, and it was just a rush to get him where he could, get some treatment and get taken care of. But today we have, he has actually done remarkably well. And today was my day to just be able to sit and talk to him. And his feet was a problem. So I go and get my cream, put the cream on his feet, go through my examination and my evaluation. And then he starts tapping his feet on the ground. He's like, man, doc, I think this is really working. Well, what is this? And then he gets up on the ball of his feet. He's like, doc, I could not even do that before. He said, I've been walking around on my heels because the ball of my feet hurts so. For over a month, he said he has been having to walk on the heels of his feet because his feet were hurting that much. And one little rub of that extreme pain cream, and he walked out feeling like a champ. True story. True story. So the pain cream, it will work in anywhere from 5 to 15 minutes. And its duration, honestly, it has been different from my patients. I have some, like the patient I had today, because he's been in so much pain for so long, he probably will be able to go a good 24 hours, because any amount of a decrease in his pain from him having a 10 out of 10 pain, if his pain, when he left, his pain, he said, was at a 3 out of 10. If his pain increases to a 7 out of 10, he's still going to feel like it's working, because it's not the 10 out of 10 excruciating pain he was having before. Now, for people who might have been using it for a minute, they might have to do it twice a day or 3 times a day. But what I also want to discuss right now is something called layering, where you use all of these products at the same time to get the most effective reduction in your symptoms. So whenever, let's talk about pain. So let's say you have a pain flare-up. Maybe you have gout, maybe you have an autoimmune disorder, maybe you stub your toe, but you're having an acute flare-up right here, right now. You want to put the cream on the area that's hurting. You want to do 3 drops of the tincture under your tongue, and you want to wait a minute, then you swallow. Then you want to do 1/4 of the gummy. The cream is going to start working right now. Oh, sorry, y'all. The cream will start working right now. The tincture is going to peak in an hour, and it's going to last for about 4 hours. And when it's wearing off, the gummy is going to kick in. So those of you who have chronic issues, chronic pain, autoimmune disorders, even high blood pressure, I definitely recommend that you do both the tincture and the gummy. And if you're having pain, add that pain cream into it as well. All of our products are lab tested. They're sent to a third-party lab that specializes in hemp to give us all the reassurance that we need that all of these products are exactly what they're supposed to be, that they don't have any pesticides, that they're following all the legal regulations on a federal level. All of our products will not have any more than 0.3% THC. But then there are some people who still have to do drug testing. And for you, we do have a pure line where all of the THC possible has been extracted. So you get 0.00% THC. These are all 100% natural. Shoot, even the dirt that our hemp products are grown in is tested to make sure that it is the best environment for growing the hemp that is going to make all of these amazing products that we have. So here we have 3 ways for you to elevate your mood. We have the pure label, gold label, and black label. So the pure label, again, if you have to do drug testing for your job, you don't want to use any of the other products except the pure line, because like I said, all of the THC possible has been extracted. So you're going to have less than 0.0% THC in the pure label. If you do not have to do drug testing, on the other hand, you might want to try our gold label. The gold label will have up to 0.3% THC. And remember, this THC, it comes from the hemp plant. So we're not talking about psychotropic effects happening. We're not talking about you getting high. We're talking about the hemp plant, which has health benefits without the high. And then we have the Delta 8 for those who are having the severe pains, for those who you've tried the gold label and it worked a bit, but not quite enough. You want to move up to the Delta 8. But also Delta 8 THC, the cousin to the real deal. This one here is more about creativity. It gets those wheels rolling in your brain. It makes you more creative. It helps you to get projects taken care of. It helps you to think of new projects. Creativity is what we really, really want to focus on or express when it comes to the Delta 8 THC. So we have our 3 different brands. We have our 3 ways to elevate your mood, and it's just up to you to decide which one is best for you. But all of these products, all of them deal with reducing your inflammation. Now, getting back to metabolic syndrome, just a couple of things. What were the 2 things that kept coming back up when it came to all of those different medical issues? Diet and sedentary lifestyle. Those 2 things play such a huge role in so many of the medical issues we have. I have to thank Akana, because before I partnered with this company, I would have been one of those doctors who said, you know, if you lose weight, you're going to be better. If you lose the weight, then you should be able to get rid of your high blood pressure and diabetes. But it's more than just losing weight. It's eating the right foods. It is being active. It is reducing stress in your life. But food is a huge thing. One of the things, as I started studying more, especially when this Flat Belly Lifestyle program came out, when I started studying foods more, it finally dawned on me one day when I was preparing for a presentation. You know what happens when people switch over to a vegan lifestyle? If they had high blood pressure, diabetes, if they had any of those diseases that come along with metabolic syndrome, all of those diseases are reversed. So just simply removing animal product, removing meats, removing eggs, removing dairy can move you from having diabetes, high blood pressure, high cholesterol to not having any of it. And so it kind of dispelled the whole idea that those medical issues are hereditary, right? Because if it's hereditary, then because my mama, my daddy, my grandparents had it, then I should also have it. But that's not the case. If you had it and then now you don't have it because you change how you eat, then it can't really be hereditary. So what is hereditary, though, is how we eat. We do inherit the way our parents and grandparents ate. And that's how come these medical disorders continue to be passed down from generation to generation. So because of this flat belly lifestyle, I have been definitely better educated on how foods affect our bodies. So with this flat belly lifestyle program, we are truly talking about reducing inflammation and reversing disease processes. And so we start off with these supplements because these supplements are helping us to get a healthy gut and helping us to give the cells and organs the nutrition that it needs to repair itself and to be healthy and functional. These things help with boosting our immune system. It helps with boosting our metabolism. And so first off, we're talking about the eliminator, which is over here with the red label. This eliminator is going to get rid of mucus and parasites in the body. Unfortunately, a lot of the things we eat have parasites. And when those parasites get into our body, they kind of take up space and they're going to stay there. They need a host to survive, and you become the host. Well, we want to get rid of those parasites because it's part of the reason why so many people have a leaky gut, an unhealthy gut. So the eliminator helps get rid of the mucus and parasites. Then we have the regenerator here with the blue label. Now the regenerator has 11 different superfoods. These are going to help with the cell repair, with the organ healthy improvements, with boosting our metabolism. You will get a burst of energy like you have not known. And so this regenerator, done 3 times a day with your breakfast, lunch, and dinner in smoothie form or with juice or with something like soy milk, 2 teaspoons will give you that boost of energy you're looking for, and it will supply our cells with the right nutrients that it needs for repair and to get our organs healthier. And then last but not least, we have the purifier, which is called the liquid colonic. So you guessed it, is our tea. You're going to use this at the end of every day, and it's going to help to remove toxins. So when you use all 3 of these products together, you're freeing up your gut. You're getting rid of all the parasites, the mucus, the toxins. You're freeing it to be able to repair, because our cells are meant to repair themselves. And as you continue to get a healthier gut, you're able to improve your immune system. As you're continuing to do that and the cells are repairing themselves and getting healthier, the organs are getting healthier, you are transitioning the pH of your body, which because of all the junk that we've put in our bodies is very acidic. You are transitioning that acidic environment in your body to one that is more alkaline, and you are reversing inflammation. How many of you realize that acidic pH and that inflammation in your body is the playground for disease? And if you can reverse that, then it will be hard for disease to thrive at all. So this flat belly lifestyle is the perfect place for everyone to start. And again, don't think because you're thin and that your BMI, so normal BMI is between 20 and 25. I have so many people that they have a BMI of 23, but their percent body fat is about 40 or 50. We call them skinny fat. So don't think just because you're skinny that you are healthy. Again, that's the American standard. But what you really want to follow is your percent body fat. That gives you a better indication of how healthy you are. And you definitely want to get with one of the Akana coaches and get your bioscan done. The bioscan uses quantum magnetic physiology. You holding a probe in your hand for 1 minute, non-invasive, it doesn't hurt a bit. And in that minute, it will send some magnetic waves through the body to communicate with all of your cells, the trillions and trillions of cells in your body. And it will tell us each and every organ system in your body, what inflammation is there, what you need to be focused on. And the answer is going to be with starting this flat belly lifestyle program. And when you finish the program, then we want you to transition over to eating for your blood type. If you're not able to do vegan, vegan is the best. When you're vegan, you're going to get reversal for sure. So if you do the flat belly first and then you go on and you do vegan, you keep the inflammation down. Same if you do eating for your blood type. Eating for your blood type helps you to stay away from the foods that are harmful for your blood type specifically. So get with someone, one of the coaches, who can get you a bioscan done and get you on the right road to reversing this disease. You know, it's one thing when you don't know, but it's a completely different thing when you know and you don't do something about it. It's heartbreaking when I can see the train wreck happening and I'm trying to give patients all the different tools they need and they just won't take it. But the problem with that is this: eventually they will, but it's usually after an event has happened. I know a lot of people can't stand taking medicines. I had a bunch of patients tell me that today. And my simple solution is, if you eat right, if you do this cleanse and then you transition to vegan or eating for your blood type, then you won't need the medicine. And I have seen this happen time and time again. It is a doable thing. Matter of fact, there is a cardiologist named Dr. Montgomery in Houston. He has a vegan, I guess a restaurant, or it's like a store connected to his clinic. He has shown that patients who have adhered to a vegan lifestyle consistently, he can show blockage regressing year after year after year just from dietary changes. This is a doable thing. We here at Akana, we just want to help you do it, and we want to help you do it the right way. So I am going to stop here. I am Dr. Kim. If you have any questions for me, you can reach me at Dr. Kim at drksd.com, and I'll be more than glad to answer any questions you may have. I am going to stop sharing my screen right now. And are there any questions? No questions? Well, I hope that means that I was clear. So listen, you should see a Q&A box at the bottom. I see 3 people have raised their hands. Click on the Q&A box and you should be able to put your question in there. Oh, thank you so much, Miss Crystal. Thank you, Dr. Betty. I think, oh, no, not the wrong Elizabeth. Thank you, Miss Elizabeth. It was great seeing you. Thank you, Miss Phyllis. Email Dr. Kim, DRKIM, at Dr. KSD. You spell out doctor. I'll go back and put it up. DOCTORKSD.com. I'll go back and put it up in a minute, Miss. Oh, actually, I guess I can put it right here for you, huh? All right. Oh, thank y'all so much. I'm glad you enjoyed, and I'm glad it was informative.
Oh, we apologize. It looks like the chat's turned off, so they can't really chat, but they figured out how to Q&A you. So,
yeah.
But amazing job. This was awesome. Oh my God.
So hopefully it was informative. I think that's all the questions I had. And I did answer. If anybody else needed the website, I can put it up, but I don't know if everybody can see it in the Q&A. I will put it up just quickly for y'all. There you go. Let's see. Yes, indeed. You know what? I have a sickle cell patient. That pain cream is absolutely phenomenal. So she has a job where she gets drug tested, but every time she goes into crisis, the pain cream, her mother will take that pain cream to the hospital because it is the only thing that actually gives her relief, believe it or not. I kid you not. No, I mean, so yeah, the CBD products for sickle cell would be amazing. So if your nephew doesn't have to do any drug testing, I actually would do the tincture, the gummy, and the cream when they're having a crisis. But if they're not having a crisis, I would keep the tincture and the gummy on board just to prevent the occurrence of a crisis. And I'm not saying it can prevent it, but to lessen the chance of a crisis happening.
We have some exciting research, Dr. Kim, coming out of Uganda with the aronia berry. And so I'm going to get you guys some information on that. I would love to connect you to the team. But the aronia berry powder apparently was shipped over to Uganda, and they suffer from a lot of sickle cell over there. And the results, I don't even want to mention it on the call because we don't want to make any claims for cure or anything like that. But I would love you guys to read the studies that are being done over there on the aronia berry. It's pretty powerful.
Please, please. I would love to read it. I can't wait to get more into that too. I definitely can't wait to get my shipment in. As a matter of fact, I think I need to order it right when we finish. Okay, I think oh, the chat is okay. My name is Jasmine. My mom has stage 4 lung cancer, colon cancer, she has to wear a colostomy bag. You know what? Honestly, Jasmine, get with the person who invited you to this meeting. Let them get your mom set up with this flat belly lifestyle program. I would definitely recommend the juicing if it's something that she can do. But when I tell you, this truly is a program where you can get some significant reduction in inflammation. It really is. Patients feel remarkably better. So, and that goes for people who are suffering with their or have a diagnosis of cancer as well. I've always known that I've always told my patients if they've ever had a diagnosis of cancer or something terminal, I always try to get them to go vegan because increasing fruits and vegetables, getting rid of meat. Meat is a very, very strong provoker of inflammation in the body. It's the cancer is going to feed from that meat. So I try and get her to do vegan. But the flat belly lifestyle program would be remarkable. If she's having pain, use that pain cream. But I would absolutely get her on board with this. Let her get a bioscan done and let her get started with that flat belly program. Would the cleanse be beneficial to a person on kidney dialysis? So with dialysis, I would highly recommend, I would say as personally, remember, so let me just say this disclaimer. I'm not anyone's physician on here. I am giving information, but I cannot make a medical decision for anybody. That being said, I have seen with my own patients where kidney function has improved with that flat belly lifestyle program. And I've actually seen some minor improvements even with just the CBD products. I would say that please, anybody who is on this call, you should be able to talk to your doctor. And if you have a doctor that does not listen or just doesn't believe in any of this, then you need to get with a doctor who is going to listen to you and do the proper research so that you're able to take the things that you need to take. Don't be afraid to be your own advocate. The reason that I'm in this company is because my patient was, nice enough, in my opinion, to let me know that she was using these products, which were actually working for her. So, I can't make a decision, as, not being her doctor, but if it were me, I wouldn't have an issue with it at all because I've seen the benefits that it can give. All right, y'all are very welcome. Okay, now all the chat is open. Thank y'all again. Anything to suggest dementia? Oh, listen, you need the gummy, you need the water soluble tincture. And look, you know what I do with the patients? I tell them to get the 8-ounce bottles of water and they can put 3 drops of tincture of the water soluble in there, 2 or 3 in there for their loved one. So you don't have to worry about them trying to hold it under their tongue and are they really doing it? And if you just put it in there, and of course, you know, you gotta man it, but do that twice a day and do 1/4 of that gummy. Yes, I have seen improvement with that as well. Welcome, welcome, welcome. Not eating much, what you do? Oh, I'm sorry to hear about your nephew. Listen, yeah, use the roll-on and get him juicing. He may not want to eat too much, but if you do the juicing and get that regenerator in his body, look, he's gonna regain his strength nicely. Miss Elizabeth said that her friend used the products and her friend had cancer. My sister started on the cleanse and her sugar shot up for 3 days and she stopped. So I guess you have to find out all that she was doing, make sure that there are certain types of fruits and vegetables that are much higher in sugar than others are. She may need to just stick with like the berries. Different berries are very low in sugar. I would also look at what kind of salad dressing she was using. And I think, Melissa, I believe you said something about this at the boot camp. I personally haven't seen it with all of the different diabetics that I've been treating. Now, what I do for my diabetics is we follow along. Well, diabetes and high blood pressure, we follow along. So once they start the cleanse, they have to check their sugar and their blood pressure 3 times a day so that I can help adjust their medicines accordingly. But Miss Rochelle, I don't know why that would happen, aside from that them eating fruits that are really, really high in sugar. And I don't know if anybody else has any other experience with this, but I just haven't seen it. Now, I haven't seen it at all with my diabetics. I would have to venture to say that they're eating foods that are high, the fruits that are high in sugar in excessive amounts.
Right. I agree with you, Dr. Kim. Our new addition to the Flat Belly Lifestyle Cleanse, excuse me, the 3.0, is our protein powder. And that actually eliminates the need to juice, because yes, that juicing can cause diabetics blood sugar to increase. And so we've had quite a bit of success with the protein powder. And so the new formula for the 3.0 is to use 2 teaspoons of the superfoods, the regenerator, and 2 teaspoons of the protein powder, and use it as a smoothie. This actually acts as a meal replacement. And it helps to, to keep the blood sugar at a balanced level, not causing any of the spikes that the juices might, because some carrots, let's face it, if people are using high numbers of carrots, well, carrots can be very, very sweet. But again, that protein powder, which is now a standard part of the Flat Belly Lifestyle, in fact, it's called 3.0, is not only, again, helping with those blood sugar issues, but it's also providing a complete protein and a meal replacement. So just wanted to put that out there.
So the protein, so that's good, because the protein actually prevents the sugar spike. So whenever you just eat foods that'll turn just to sugar, you pretty much get a spike of the sugar, and then it's quickly taken care of. But when you have protein on board, it gives you a more gradual absorption of the sugar and then a gradual decline of that sugar. So there you have it, Flat Belly Lifestyle 3.0. And again, I haven't seen it, but again, I guess I believe that it's probably too much of those rich food. And remember this too, the reason why vegans can switch over, because there's always a question. You go from eating the meats or the animal products to not eating it at all, because meats have a strong inflammatory, provoking property about it. And if you think about it this way, if you're eating meat, your pancreas is inflamed and it cannot produce the insulin the way it needs to, plus inflammation in other parts of the body, the excess fatty tissue. So now insulin that does get released can't even bind to the organs the way they're supposed to suck up the sugar. So if you still have those inflammatory processes going on and you eat, or you're doing the cleanse, and you're taking in all the juice and the sugar that's in the juice, well, yeah, you're gonna go up, you're gonna go very high. So that is a kind of already has an answer for that with the smoothie. So, okay, I'm 2 minutes over, y'all. I'm answer this last thing. Miss Claudia asked if drinking the detox tea at night, will it pull out all my CBD out? So keep in mind that the detox tea is cleansing your GI tract. So once you've done your CBD part, for the tincture for sure, you don't even have to worry about the tincture because it's under the tongue and it gets absorbed through the mucosa in the mouth. But the gummy, whenever you do the gummy, is pretty much the same. I mean, once you chew it up and you swallow, essentially you're gonna have the absorption. And so by the time you're doing this tea at the end of your night, unless you're trying to use it for sleep, I would say that you definitely need to use the tincture if you're doing that detox. But also, when you're doing the detox, your gut is going to be healthier. Your need for the tincture and the gummy is going to change. You're probably going to need less. So the recommendation is that you hold off on that while you're doing the cleanse, and then you go back to it after. And that way you're in a good place. You're not at risk of getting rid of anything essential that you're trying to do. And then you're safe. Okay, I wish I could answer all of the questions, but I have to get off, everybody. But send your questions to Dr. Kim at drksd.com, and I promise you I will get to it. It's busy, but I promise I will get to it, and I will send you an answer. So thank all of you very much for having me. Thank you for all the wonderful questions and for your attentiveness. Good night, everybody.
Good night.